Hi, this is Liberato Martinez. Thank you for joining me today. Today we're going to talk about Medicare Supplement Plans and the top 3 plans based off of cost and coverage. So let's go ahead and get started. So before we get right into the Medicare Supplement Plans, it's important that you know about the background of original Medicare. That's your Part A and your Part B. And we're going to do a brief comparison for Medicare Advantage. So I will be doing another video that will go in depth on Medicare Supplement versus Medicare Advantage, so stay tuned. But for now, we're going to do a brief and then go spend a lot more time on Medicare Supplement Plans and how it works. So before we get started though, please go ahead and like and subscribe so you can get notifications and take advantage of more educational videos that are coming your way for Medicare. So the first thing is that you need to enroll in original Medicare, Medicare Part A and Medicare Part B. And then from there, you have a few options. So original Medicare is Medicare Part A, that is your hospital coverage, and it costs you $0 as long as you meet the qualifications. And then you have Medicare Part B, and that covers your medical. And that costs you $174.70 for the standard rate. It is income-based. Most Americans will pay $174.70 in 2024. And from there, you have a few options. We're going to talk about options 1 and options 2, which is Medicare Supplement and Medicare Advantage. However, you do have another option to stay in original Medicare and enroll in a prescription drug plan. A little word of caution. Original Medicare Part B does cover you at 80% coinsurance. That means you're responsible for 20% of the bill with no limit. So be careful with that one. If you do want to get rid of that 20% liability, you have a couple of options. First option is to go Medicare Supplement. So Medicare Supplement is where original Medicare pays the bill, and whatever original Medicare does not pay, Medicare Supplement will pay the difference. That's why it's also called Medigap. And you have a few options we're going to talk about today: Medicare Part F, Medicare Supplement Plan F, Medicare Supplement Plan G, and Plan N. That's what we're going to go in depth in today. Now, when you do go with this option with Medicare Supplement, you will need to pay for and purchase a prescription drug plan, a Medicare Part D plan, D for drug. And you will need to, and we'll talk more about that as well. The other option is to enroll in a Medicare Advantage plan. Now, Medicare Advantage plans have much lower cost. They could be as low as $0 in most areas in the United States. They can include extras. They can include the prescription drug plan in the cost as well. And they can include extras like dental, vision, hearing, gym membership, and a lot more. So you have 2 options there. So with the Medicare Supplement option, original Medicare pays the first portion of the bill. Whatever original Medicare Part A and B does not pay for, Medicare Supplement will pay the difference. And this is a big benefit. There is no physician's network with Medicare Supplement plans. You can go see any doctor in the United States that accepts original Medicare. So you have a lot of freedom built in with Medicare Supplement. So back over to Medicare Advantage. What Medicare Advantage does, it replaces original Medicare. And now your health care is managed by a private company, and there is a network. So in order to get the benefits, you need to stay in network. And that's really important. Now, you could be okay with that, and that might work out just fine. And another thing is that Medicare Advantage has no underwriting. There is some underwriting with Medicare Supplement. We're going to talk about that a little bit later in this video. You do have your first 6 months of open enrollment for Medicare Supplement to get guaranteed issue, and we'll talk about that. Now, don't forget, you have that option to stay in original Medicare and purchase a standalone prescription drug plan. So here's kind of the flow of things. Happy birthday, you turn 65, or hey, I'm leaving my work plan and now I'm going to enroll in Medicare. You need to enroll in original Medicare, Medicare Part A and Medicare Part B. Now from there, you also need to purchase a standalone prescription plan. Cost there could be as low as 40 cents. on up. But the average, I'm going to say, is around $35. And then you have Medicare Supplement Plan. From there, you would enroll in a Medicare Supplement Plan if you choose this option, also known as Medigap Plans. Now, as I mentioned, original Medicare costs about $174.70. That's the standard rate, depending on your income. Most Americans pay that $174.70 for the Part B, so that's your initial cost. You always need to pay that $174.70. That always has to get paid no matter which option that you take. Now, that cost on the prescription drug plan is about $35, $38 approximately. That's the average cost. And then the churning 65 rate for a Medicare supplement plan, depending on which plan you select and depending on the geography that you live in the United States, the range could be anywhere from $75 to $150. It varies by territory. Now, what's all this going to cost you? So let's just look at the Medicare supplement option. Part A is $0. Medicare Part B is $174.70 for the standard rate. Let's just say your Part D for prescriptions, D for drugs, is $35. And I'm going to give you an example for Plan G. Plan G is about $125 depending on where you live in the country. So let's just use that rate for an example, $125. Your total monthly cost for Medicare supplement is $334.70 per month. That's an annual expenditure in premiums of $4,016.40. Now, on this Medicare Part B, on this Medicare Plan G, you do have the Part B deductible of $240. So now your total annual cost is $4,256.40. Now, this does not include any copays for your prescriptions. So that is a separate plan, and you will have a separate copay schedule depending on the medications that you take. So what do you get for that $4,256.40? You get a lot of freedom. You can go to any doctor in the United States that accepts original Medicare, no referral needed. There is no network, so you get the most freedom here. Now let's compare that cost to Medicare Advantage. So Medicare Advantage in 2024, you're looking at most premiums are $0. So Medicare Part A is $0. Medicare Part B, still $174.70 standard rate. And Medicare Part C, Medicare Advantage, is typically $0 for you. You will see, so combined, you're going to see an annual rate of $2,096.40. However, you're going to have copays. Copays could be very low, like $0 in some areas, but in other areas you may have higher copays. So, and that could add up if it's something extreme like hospitalization or skilled nursing facilities, or even like if you had a dialysis treatment. So that could turn into a lot. But one thing to keep in mind with Medicare Advantage plans is that you do have a maximum out-of-pocket that will protect you. That is the most that you can pay in these plans. Now, the maximum out-of-pocket does have a very wide range. It could range, depending on your area, anywhere from a low couple $100 maximum out-of-pocket up to, let's say, $8,850 maximum out-of-pocket. So there are copays. You do have some liability. However, you do have that maximum out-of-pocket to protect you. Now remember, there is a network with Medicare Advantage. So you need to make sure that you are stay in network to get the coverage that you need. And again, this does not include the copays for prescriptions. So moving on, let's talk about who takes Medicare Supplement. With Medicare Supplement, it's super easy. There is no medical network. So any doctor in the United States that accepts Medicare, you can go see with absolutely no referral. As compared to Medicare Advantage, where there is a network, you will often need a referral if it's an HMO, and there is a network that you need to stay in. So Medicare Supplement gives you the most freedom. Now, the three plans that we're going to talk about is Medicare Supplement Plan F, Plan G, and Plan N. So the first one is Plan F. Now, one thing about Medicare Plan F, I am going to put it here for illustration rates because it does have very good coverage, and a lot of you do qualify for Medicare Plan F. But you have to be born before 1952, either in 1952 or earlier. You qualify for Medicare Plan F. If you are born after 1952, you are not eligible for Plan F. But if you are, Plan F gives you the most comprehensive coverage. The premium is a bit higher. It's the higher of the three. There is no Part B deductible, and there are no copays. So it works very easy. Basically, you're going to pay your monthly premium, whatever that is in your area for your age, and then that's it. You're not going to see a medical bill after that. So as long as it is medically necessary, and whatever original Medicare is going to pay, and whatever original Medicare does not pay, Medicare Supplement will pay the difference. Now, let's talk a little bit about Plan G. So Medicare Plan G isn't quite as expensive as a Plan F, but you will be paying your $240 deductible. And after that $240 deductible, you have no copays. So you're going to pay $240, and then that's it. It's $0 from then on out. Now, that difference, as you age, the rate's going to age. So if you're paying a significant amount for Plan F, or you think you are, in some states, you'll have the option to move to a Plan G during certain times of the year with no underwriting and move into a Plan G. So that might be, that $240 deductible might be worth it to you. Now, the next one is Medicare Supplement Plan N. Of the three, it is the most affordable. So it's just like Part G, where you have that $240 deductible. However, you do have some copays. So Plan N has the $240 deductible and a $20 copay every time you go see the doctor. And if you do go to the emergency room, there will be a $50 copay. So you can see how I've illustrated how the rates are going down as you go from Plan F to Plan G, Plan N. So something to be cognizant of. Now, that monthly savings that you could have could be worth it to take on that deductible or those copays. But if you go to the doctor a lot, like once a month, twice a month, you may eat up that savings by paying those copays on a monthly basis. So now let's go ahead and talk about Medicare Supplement Open Enrollment. So Medicare Supplement Open Enrollment, this is just for Medicare Supplement, not to be confused with Medicare Advantage Open Enrollment. But for Medicare Supplement, it works a little bit different. You get a one-time guaranteed issue when your Part B starts. It's basically 6 months from when your Part B start date is, and you have to be at least 65 years old. So let's say you enroll in Medicare Part B when you turn 65. Happy birthday, you're turning 65. Here's your Medicare Part A, here's your Medicare Part B, and let's just say it starts your birthday month. Well, you have 6-month window from your birthday month onward. So if you're born in January and your Part B starts in January, you have until the end of June to enroll in a Medicare supplement plan with no underwriting, guaranteed issue, regardless of your health condition. If you wait past that, you are going to have underwriting. The other example is, let's say you're working, you are now going to retire and leave your work plan, and you get Medicare Part B at that time. That's when your window starts. You have your 6 months. You can enroll in Medicare Supplement without underwriting. Now, after open enrollment, you must go through underwriting to enroll in a Medicare Supplement plan in most states. There are exceptions with certain trial rights. However, the general rule of thumb is that you have that 6-month window. So, we covered a bit. I hope you understand a little bit more about Medicare Supplement Plan. Just remember, you need to enroll in original Medicare, Part A and B. We went over the cost, and now you've seen some of the differences between Plan F, Plan G, and Plan N. And don't forget, you also need to purchase a standalone prescription drug plan. So I hope that helps you in understanding Medicare Supplement. Look out for my next video where I am going to compare in more depth the difference between Medicare Supplement and Medicare Advantage. Thank you so much for listening. Please, if you feel this is helpful, please share this with your friends and family. And also, please don't forget to like and subscribe so that you can go ahead and get notified when I post more videos to help educate you to make the best choice for your Medicare. Have a great day.